Question number 2, how does pregnancy affect lupus? So women who have lupus, who get pregnant, do have an increased risk of complications associated with pregnancy. Now, I will say over the past decades with advances in treatment, the risks associated with lupus and pregnancy have dramatically decreased, but we still do see an increased rate of stillbirth babies, of preterm labor, which is when a woman goes into labor a bit too early, as well as low birth weight babies in patients with lupus compared to patients without lupus. One of the bigger concerns associated with pregnancy and lupus is there is an increased risk for flares, for lupus flares during pregnancy. And that's why it's really important, you'll hear it stressed a lot, that prior to being pregnancy, you should have a 6-month period without flares, as that dramatically reduces the likelihood of having a flare during pregnancy. Now, usually the flares that occur during pregnancy occur in the first or second trimester and tend to be relatively mild and can be treated with corticosteroids. However, it is possible to have very severe flares which need to be treated with much higher doses of corticosteroids, and sometimes very severe flares may require the delivery of the baby, even if it's early. There is a condition called preeclampsia, which is associated with patients who have lupus and especially patients who have a history of kidney disease. With preeclampsia, patients may notice that they have swelling in their hands or in their feet. They may have headaches, feel dizziness, or feel overall just ill, associated with stomach pain. And the treatment of this, especially if it's very bad, is the delivery of the baby, even if it's early for the baby. All in all, the studies show that if we get pregnant after having no flares in a 6-month period while taking medications we can continue during pregnancy, the likelihood of having some of these adverse events during pregnancy decreases. So it's really important to be sure to communicate with your rheumatologist and your high-risk OB-GYN if you have any desire of becoming pregnant to provide for appropriate planning.